Yes, today we are seeing different echocardiographic views recorded from different windows. And the first one here, it is the parasternal long axis. And then the anatomy we can see, as you see from the above, near the transducer, we have the right ventricular outflow tract. The next one is interventricular septum, labeled as IVS, and then LV, left ventricle, and then left ventricular posterior wall. Then we also see the aorta and the aortic valve there, where the arrow is. That is the aortic valve, and this is the aorta. Then the next one, we are seeing left atrium, and then the associated mitral valve, which opens into the left ventricle. By the way, you see how the arrow is moving. So this is the anatomy that we can see in a parasternal long axis. The next view is going to be the parasternal short axis, and it's here. This is at the level of mitral valve, Plaque's view, like PSA-X, that is parasternal short axis. And what we see on top there, above, because we are cutting the heart into two. So we see the right ventricular cavity and the left ventricular cavity. And what you see inside there is the mitral valve opening. That is the parasternal short axis at the level of mitral valve. This is another parasternal short axis, now above at the level of aortic valve. And this is what we see. We see near the transducer, the right ventricular outflow tract. The outflow tract opens into the pulmonary artery. Now in between, we have the aortic valve. You can see how it opens and closes. And then behind the aorta, we have left atrium, and then right atrium, and then tricuspid valve here. You see how it opens into the RV. So that is the short axis, and that is the two levels we can take. One level remaining. One level of short axis remaining. This is the anatomy. This is how it should be labeled. So when you're watching, when echo is being done or you're doing it, this is how it looks like. One missing at the level of papillary muscle, but this is the fourth chamber. It's not clear, but this is the fourth chamber. And we see both chambers, all chambers, the left atrium here, right atrium, left ventricle, and then right ventricle, separated by interventricular septum. And then the two valves, that is the mitral valve between left atrium and left ventricle, and then tricuspid valve between the right atrium and the right ventricle. The apex, it's near the transducer because this is apical fourth chamber. So the transducer is put at the cardiac impulse, point of cardiac impulse. That is where the apex is, on the chest of the patient. It's not clear, but this is fourth chamber. That's why I labeled them. This is plaques, already saw. This one also already saw. This one saw. Now that one also finished. So the next one, finished everything. This is two chamber. Two chamber is gone. It was two chamber, but two chamber finished. And these are the measurements that we can take. You see here, mitral valve is 5 chamber. It had come. And then these are the measurements you have taken in the plaques at the level of papillary muscle. This is plaques M mode at the level of aortic valve. The first one was at the level of papillary muscle. And these are the measurements we can take. We can take the RVOT measurement, aortic valve measurement, aortic measurement, like that is aortic diameter. And then we also take the left atrial diameter. We can measure from here, from long axis, parasternal long axis, with an M mode at the level of aortic valve. This is plaques at the level of papillary muscle, and we are measuring the diameters of, or the dimensions of, interventricular septum, and then LV cavity in diastole and in systole. So from here we can take the ejection fraction, and these are the readings we took. IVS, interventricular septum in diastole, left ventricular internal dimensions in diastole, left ventricular posterior wall diameter, left ventricular internal dimension is in systole, and then left ventricular posterior wall in systole. Then from there, we get end diastolic volume, and then fractional shortening, and then EF, and so on. This is again four chamber clear ones. This is more clear, and then this is at aortic valve. We take measurement. This is tricuspid valve. This is you apply color to see whether there is regurgitation. This one is finished.